Eyelid surgery can be a life-changing experience. It can help you see better, look younger, and feel more self-confident too. But not everyone should get eyelid surgery or blepharoplasty. So in this video, I'm going to help you perform a self-test. It's similar to the testing we do in our office during our eyelid surgery consultations to help you figure out whether you're a good candidate for surgery or not. I'm also going to talk about my experience performing these surgeries and tell you the really important things you need to know before signing up for surgery, like the different causes of droopy eyelids, the types of surgery available to fix them, and the important difference between functional and cosmetic surgery. By the way, I'm Dr. Michael Chua. I'm a board-certified ophthalmologist, and I make videos to help you see better, look better, and feel better too. Okay, so this test we're going to perform is called a visual field test. This allows us to test whether your droopy eyelids are causing problems with your peripheral vision. And I programmed this test to specifically test your peripheral vision in the upper half of your vision. After the test, I'll explain why the results of this test are so important. How these visual field tests work is you cover one eye. Let's start by covering our right eye and look at the target in the center of the screen. It's important that you keep your eye focused on that central target. You don't want to move your eye all over the place because if you move your eye around, then we're not really sure we're testing your peripheral vision anymore. As you're staring centrally, the test will flash small lights in your peripheral vision. Now, it depends on how close you are to your screen, but you basically want to make this video test nice and big in your visual field, so you might have to get a little bit closer to your screen. In the office, you press a button whenever you see the flashes, but for this home test, let's have you count how many flashes you see. Okay, did you see 10 flashes? If you did, then you saw them all. If you notice you have droopy eyelids and missed some of those flashes, it's possible that your eyelids are covering the upper half of your vision. If we see that your eyelids are causing problems with your peripheral vision, then your eyelid surgery would be considered functional surgery and might be covered by insurance. Now, you can go back and run the test again for your right eye and compare the results with your left eye. Quick disclaimer, please remember that this is a simplified screening tool for educational and entertainment purposes only. It's not a substitute for a real eye exam and a formal visual field test performed in a doctor's office. Okay, now that we have the results of our visual field test, let's talk about the two main reasons why an eyelid might look droopy. Dermatochalasis is the medical term for having excess skin, muscle, or fat on the upper eyelid. This excess skin can hang down over the eyelashes and block your vision. Ptosis is when the eyelid itself is in a lower position than normal. This isn't an issue with excess skin, but rather a weakening of the small muscles that are responsible for lifting the eyelid. Sometimes a patient can have both conditions at the same time. The reason this distinction is so important, dermatochalasis versus ptosis, is because it determines the type of surgery needed to fix the problem. If your main problem is loose, hanging skin, then that's what we need to remove, your loose, hanging skin. But if your main problem are weak eyelid muscles, then we need to tighten up those eyelid muscles. And so that leads us to the two main types of surgery. A blepharoplasty is the procedure that addresses dermatochalasis or excess skin. During the surgery, your surgeon carefully removes the extra skin, muscle, and sometimes a small amount of fat from the upper eyelid. A ptosis repair, on the other hand, addresses the weak eyelid lifting muscles. The goal of this surgery is not to remove skin, but to find and tighten those eyelid muscles to raise the height of the entire eyelid. This surgery corrects the position of the eyelid margin itself. In some cases, and I do this quite often, a patient might need both procedures done at the same time to achieve the best functional and cosmetic result. Okay, now that we understand the different types of eyelid surgery, we want to look at functional versus cosmetic surgery. This difference determines whether your health insurance will pay for the surgery or not. So first, functional surgery. For a procedure to be considered a medically necessary functional surgery, we must prove that the droopy eyelid is causing a vision problem. The most common way we do this is with a visual field test in our office, which is very similar to the one you just took. This test precisely maps out your field of vision, both with your eyelid relaxed and with it taped up. If the test shows a significant blockage of your vision, insurance will typically consider the surgery as functional and pay for it. Patients also often report complaints like difficulty reading or difficulty keeping their eyes open to watch TV or drive because of their droopy eyelids. If the eyelid droop isn't blocking your vision, then the surgery is considered cosmetic. This means that it's being performed solely to improve your appearance. In those cases, insurance won't cover the procedure and you'd be paying out of pocket. If you're thinking about eyelid surgery, here are a few important things to consider. A thorough consultation is very important. During your consultation, your surgeon should perform a comprehensive exam, including measuring your eyelid function, assessing for dry eye, and discussing your specific goals. Although eyelid surgery is very safe, all surgery has risks. The most common risk with eyelid surgery is dry eye, which is often temporary, but sometimes it can be permanent. Other risks include bleeding, infection, scarring, asymmetry or uneven results or contours between the two eyes, and difficulty fully closing the eyes, which we call lag ophthalmos. In terms of recovery, you'll have significant bruising and swelling for the first few months after the surgery. While you may be able to return to work after a week or two, the final results of your surgery can take several months to fully settle as the swelling completely resolves. So, to summarize, droopy eyelids can be more than just a cosmetic problem. They can be a real medical issue that impacts your daily life. Our at-home test can give you an idea if your eyelids might be blocking your vision, but obviously, a formal evaluation is always necessary. And now you understand the difference between a blepharoplasty for excess skin and a ptosis repair where you would need to tighten up those weak eyelid muscles. I hope this video was helpful to you. If you found it useful, please give us a like and subscribe to the channel for more updates. And if you live in the Los Angeles, Orange County, or Inland Empire area and want to get your eyelids checked out, feel free to visit our website or give our office a call to make an appointment today. I'm Dr. Michael Chua. See you next time.